Today we'll be examining the foot and the ankle. My name is Nigel Booth and with me Stephanie.
Hi.
As sport medicine practitioner, we may be called in to examine the foot and the ankle for someone who is having pain, swelling, or an injury to the foot and the ankle. And it's important that, as you examine the foot and the ankle, there are clues that you could get. One of the clues may be from the shoe, looking at the wear pattern of the shoe to see if there's any wearing of the shoe or any twisting of the shoe. Now, in addition, as Stephanie stands, we could start off by just looking at the alignment of the foot, looking to see if there's any evidence of any flat foot or if the arch of the foot is high or if it's normal. And with Stephanie, we do have a little bit of flat-footedness. So from here, we'll get Stephanie to do a walk. And as she walks, we're looking at her gait, looking to see if there's any evidence of any pain, looking at her heel-toe strike, just to see if there's any abnormality with that. So we'll get Stephanie now to sit. And with Stephanie seated, we're just going to be looking at her ankle, examining to see if there's any evidence of any scar, ankle and foot, which may be an indication of previous surgery. We're looking to see if there's any evidence of any hallux valgus, which is a lateral deviation of the toe, which is normal for Stephanie. Any evidence of hammer toes, which is normal for Stephanie. Any bunions, callus, or any bruises or swelling around the foot and the ankle. Next, we'd want to start off by doing palpation. And it's important to recognize that with ankle fractures, you can have fracture of the ankle that involves the neck of the fibula. So you'd want to start your palpation from the head of the fibula down, checking for any evidence of any pain. Any pain, Stephanie? Okay. All the way down to the lateral malleolus, the medial malleolus, calcaneus. If we do inversion, the talus, the navicular, which is medial, down on the medial metatarsal, base of the fifth metatarsal, down on the shaft, along the metacarpophalangeal joint, the phalanx, and the cuboid bones. And after this palpation, we're going to be moving on to do palpation of the ligaments, and we'll start off by palpating behind the medial malleolus, checking for the tendon of the flexor hallucis and the tibialis posterior, checking the Achilles tendon to make sure that there is no, you could just turn your foot a little, to make sure that there is no discontinuity of the Achilles tendon. We're going to check for the deltoid ligament, which is on the medial aspect of the foot below the medial malleolus. The lateral ligaments, which are three component. There is the anterior talofibular ligament, which you'll feel just anteriorly there. The calcaneofibular ligament, which is almost immediately below the lateral malleolus. And the posterior talofibular ligament, which you can feel in extension posteriorly. Okay, from here, you want to examine the syndesmosis, which is between the tibia and the fibula. And then we'd want to do examination of the arches in the foot, which is the dorsalis pedis, and the posterior tibialis, which is on behind the medial malleolus, and there's good pulsation. From here, we're going to be moving on to examining range of movement of the foot and the ankle, and we'll do active and passive range of movement. So if you do dorsiflexion for me, Stephanie, up, plantar flexion down, inversion in, eversion out. And we're doing these stabilizing ankle dorsiflexion. Okay, with dorsiflexion we should get about 10 to 15 degrees, plantar flexion about 50 degrees, inversion about 40 degrees, eversion about 10 degrees. Okay? Now, range of movement may be restricted if there's any evidence of any pain or swelling along the joint. Now, in addition, we'd like to do examination of the subtalar joint. So if we stabilize ankle, we could do examination of the subtalar joint, stabilize the hind foot, examination of the mid-talar range of movement, checking for inversion and eversion. We want to do range of movement of the first metatarsophalangeal joint, checking for flexion and extension, and then the crepitus, range of movements of the toes. Okay, and then we'll move on from here to do resistance testing. And resistance testing, we're going to do dorsiflexion. Stephanie, push your foot down, and that's done with the knee straight. Push your foot down, and the knee flex. And with the knee straight, it's a test of the gastrocnemius, and with the knee flex, it's a test of the soleus. Plantar flexion, foot up for me, Stephanie. Okay, inversion, foot in, don't let me push it out. Eversion, foot out, don't let me push it in. Okay, and then from here, we're going to be moving on to do special tests. And special tests that we're going to be doing is first, test to check the integrity of the anterior talar fibular ligament, which is the ligament that's most commonly damaged in the ankle. And this is done by doing an anterior jaw. So with the patient seated, flex, foot in neutral, we're going to be stabilizing the ankle, grasping the calcaneus. And from here, if you could see me well, we're going to be doing an anterior jaw, looking to see if there's any anterior translation of the ankle joint. And that is good. Then we'll move on to do, second from here, a talar tilt test. And also with Stephanie seated, the talar tilt test is going to be done by stabilizing the ankle, and then we are going to be doing inversion, okay? And the talar tilt test is going to be testing the integrity of the lateral ligaments of the ankle. That's lateral ligaments. There are three: the anterior talar fibular ligament, the calcaneal fibula, and the posterior talar fibular ligament, okay? And that's good. Then from here, we're going to be moving on to be testing external rotation, or the Kleiger's test. And this is done to identify any evidence of any syndesmosis injury or fractures. And with this, you get the foot in, stabilize the ankle, and then we're going to put the foot in external rotation. And if there's any evidence of any syndesmosis injuries, Stephanie will have pain, any pain, or there may be increased mobility if there's rupture of the deltoid ligament of the ankle. And this is done comparing on both sides. From here, we're going to be moving on to do tests of the Achilles integrity. So this is done by doing what's called a Thompson's test. If you could lie down, Stephanie, lie the tummy for me, please. Just take this out of the way. Lie the tummy. And here, we're going to be, Thompson's test is testing the integrity of the Achilles tendon. So with the foot inflection, we'll do squeeze of the calf muscle, and a negative test is where you'll get dorsiflexion of the ankle as you squeeze the calf muscle. If the Achilles tendon is ruptured, then there is no dorsiflexion as you squeeze the calf muscle. Okay, then from Stephanie, moving. So moving on, we'll do what's called a compression test. And the compression test is done to test the integrity of the syndesmosis. And what we're doing is compression starting from all the way up, compressing the tibia and the fibula together, okay, all the way down to the malleola. And usually the height at which you get pain is a suggestion of how high that tear in the syndesmosis extends. So if there's pain at the top, it means that there's a rip of the syndesmosis all the way. If there's no pain at the top and pain at the bottom, it means the rips of the syndesmosis is down at the bottom. And also if there's pain if there's a fracture along the fibula, this may also demonstrate pain. Okay, from here, we get Stephanie up. That completes our examination. Thank you.